I was diagnosed with cancer when I was 31. It paused my life. But when I found out my fertility was probably going to be at risk from chemotherapy and other treatment I was facing, I was devastated, devastated. I started 4 rounds of chemotherapy treatment, and when I checked in with my second opinion oncologist, it turned out he didn't agree with the drugs that I was already taking. So here I have 2 oncologists who don't even agree on what poison was supposed to be going into my body to save my life. And it was a really frustrating moment because I was going back and forth. And in my head, it was like a ping pong. Who do I trust? I don't know why I had the foresight at 31 years old to get both of them on the phone on a conference call with me. So they could debate about what my options were and I could actually hear their critical thinking process so I could decide for myself. I'm Alice Creasy, founder and CEO of MedAnswers. I wanted to connect patients with experts right upon diagnosis. And I wanted those experts to deliver answers they agree to. When you are facing a health crisis like infertility or cancer or heart disease or something unknown, is you have to weed through piles and piles of information online. You do a Google search for infertility, you get 28 million hits. So whoever has the best SEO is whose page you read. That isn't necessarily the best or most relevant information to you.
My name is Santiago Munet. I'm a geneticist by training, entrepreneur by accident. The first company that I formed was Reprogenetics, which basically tested embryos to see if they are chromosomally or genetically normal. The second company that we formed was Recombine, which tested couples for gene defects. And the third company that I'm funding now with Alice is MedAnswers. Here my role, it's been as an investor and also as a scientific advisor for the company.
Santi tested my embryos when I had Dante, actually. He tested 9 embryos. 7 were good. Transferred 2, and I got my son. There are 2 things that right out of the gate make MedAnswers very different than other applications in specialty medicine. The first is the peer validated network. Who knows better who the experts really are than the experts themselves? They attend all the scientific symposiums. They know who's conducted the research. They know whose opinion they're relying on to implement in their own practice. The second is clinical consensus. There are a lot of places you can ask a physician a question, but there is no other place where the experts in that network will agree with each other or disagree with each other and then write their own answer that provides more information for the patient. If you're about to spend $20,000 on an IVF cycle, wouldn't you want to spend just a few hundred to find out if that exact treatment is the right one for you? Rather than look at these statistics like, well, they said I have a 60% chance of it working, or I have a 20% chance of it working. Why not get 12 experts to agree with whether or not that's the right approach for you? Why not? The experts are already on Facebook, they're already on Twitter, they're already on LinkedIn. The experts have made themselves so available in all these different mediums, and that's incredibly inefficient for them too. So let's solve that. Let's remove the inefficiencies in this particular vertical, prove that we can help suggest products and services that these patients need so that they can get to their answer faster. Patients, for the first time ever, can have confidence in their treatment plan decisions at an unprecedented level during one of the most important times of their life. I was one of the lucky ones, and I had a chance to preserve my fertility when I was diagnosed with cancer. My son was conceived in 2008. He was born in 2013. I waited 5 years to do my embryo transfer until I was cleared by my oncologist. And not so ironically, I got to hear his heartbeat on my 5-year cancerversary. And I want everybody to have that moment. I want everyone who thought that they couldn't live that life as a mother, as a father, I want them to have that moment. Anyone who wants the dirty diapers, the fatigue, the not sleeping through the night, maybe until they're 16. Anybody who wants those moments, I want to help them get there. And I want to help them get there faster and for less money and with far less stress.